Hello, 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 NCLEX Crusaders. Welcome one more day to our NCLEX Crusade International YouTube channel. And of course, today we will be learning about dosage calculation. I know that dosage calculation is an area of weakness for many nurses out there. If you are in the nursing program or if you are preparing for the NCLEX, I want you to join our community. I want you to join our YouTube channel so you can learn every week NCLEX concepts. So you can improve your critical thinking. You can learn about nursing knowledge. And of course, once you're ready to take the NCLEX, that you can pass it on your first attempt. So I want to welcome each one of you that have taken the opportunity to join us live on this day. And it is a pleasure for me to guide you as always. Let's begin with dosage calculation, and I will be teaching you tonight or this afternoon, wherever you are right now, about NCLEX dosage calculation. As you know already, there are different tools that you can use to learn how to do this dosage calculation. And I want to make this clear. If you are not struggling with dosage calculation, if you're using a system that works for you and you are getting those NCLEX dosage calculation questions correctly, then I do not want you to change anything that is working for you. However, if you're one of those nurses that math and dosage calculation, it is really a struggle, you're really having a lot of difficulty answering these type of questions, then I will teach you a strategy today that is called the dimensional analysis strategy. I must begin saying this is not an easy strategy. The first time that you listen to this, you might struggle a little bit. It might take you some time to really understand and grasp the concept of the dimensional analysis strategy. But if you give it enough time, if you have faith, and you really learn how to use this strategy, it will make your life easier when it comes to answering math questions on the NCLEX. Let's begin with the steps of the dimensional analysis strategy, and then we will practice 3 scenarios where I will show you how to use this dimensional analysis strategy to answer dosage calculation questions. Now, today we are not discussing pediatric specific dosage calculation questions. We're starting with the general knowledge of dosage calculation, and this will help you answer more than 90% of the NCLEX dosage calculation questions that you could encounter the day of your exam. So first step, it is to look at the problem and collect information. That is the first step that I want you to do. Look at the question and collect information, and I will show you how you're going to collect that information. Step number 2, you have to determine if you need a conversion factor. And I will tell you what a conversion factor is. And step number 3, you will solve the problem. And after you solve the problem, whenever you have your answer, you need to identify if that answer makes sense. And this is a very interesting question, and it's going to save you from a lot of trouble. Because you could do all the question, all the math problem, and at the end, you get a weird number. If that number does not make sense, you have to restart again from the beginning. This is very important. Let's say, for example, you're giving XYZ medication to a pediatric client, and then you get that the answer of how many milligrams of XYZ medication that you will be administering is 40,000 milligrams. That doesn't make sense. That is probably not a correct answer. So this is what I mean when I say you need to identify if the answer that you have makes sense. Is it too large or too small for that specific patient or client? Another information that I want to share on this YouTube live is some of the conversion factors. I am not going to show you all of them, but I want you to know what a conversion factor is, and you need to memorize this, because on the NCLEX they will not provide you, at least on not most of the math questions that you could encounter, they will not provide the conversion factor or what is known as the equivalence. What do I mean by that? Let's say you need to convert from milliliters to liters, from liters to milliliters in order to calculate a dosage calculation question. Well, you need a conversion factor. What is a conversion factor? For example, if I say how many milliliters are in 1 liter, in 1 liter you have 1000 ml or 1000 milliliters. At the same time, if I ask you how many milligrams are in 1 gram, 1 gram equals 1000 milligrams. If I ask you how many grams are in 1 kilogram, in 1 kilogram there are 1000 grams. These are known as conversion factors or equivalents. In this chart that you have in front of you, you have the metric system abbreviation and equivalence. So I want you to take note of this and save it so you can study it later on, okay? There are also metric and household system equivalents. The household system equivalents are very important, especially for questions that have to do with intake and output, okay? A lot of those questions that deal with intake and output where you have to do several calculations, you can use this metric and household system equivalents or conversion factors. For example, 1 ml equals 15 drops. 5 ml equals 60 drops. There are several mLs in a tablespoon and several mLs in a teaspoon. So here are the conversion factors. All you have to do is memorize it. 240 ml in 1 cup. There are 8 ounces in 1 cup, and so on. So I do not want to waste any more time, and let's begin with the first math question, the first dosage calculation question. And what I will do, I brought for this YouTube live training, I brought 3 different types of dosage calculation questions. We will start with the basic one, then we're gonna see another one that is a little bit more difficult, and then we're gonna see a larger problem, okay? All right, so let's begin. And what I want you to do as I review this question, I want you to try to solve the problem yourself. If you're watching this training on the replay later on, make sure that you're pausing this video at the question and try to solve the question yourself first before you see the explanation. It is a little bit more difficult if you're seeing it live, because I'm not going to give you any time specifically to think about the question. I will just begin explaining it. But for those of you who are watching this video later on, you really have an opportunity to learn and practice this question. So let's begin with the first dosage calculation problem. It states, the client has a prescription of dexamethasone 6 milligrams IV push stat. Stat means immediately. The available vial contains dexamethasone 4 milligrams per milliliters. The nurse should draw X milliliters into the syringe for the dose, for the administration of the dose. record your answer using 1 decimal place. It is extremely important to pay attention to the details. It is important to identify if the question asks you to only record your answer, or if it states round your answer. If it tells you record your answer up to what point, do they want you to record the whole number? Do they want you to record the first decimal place? Do they want you to round to what? Round to the whole number or round to the first decimal place? So it is important that you pay attention to these details. That is why I want you to do the first step of the dimensional analysis strategy, which is to collect information. And what you have to do, you have to identify the information that are together, and you have to turn it into a fraction. Okay, I know that we're going back to probably several years ago when you were like in elementary school or in 3rd grade or 4th grade, but it is important to remember these rules. You may say, Professor, but can I use a formula to answer these questions? Absolutely. You can use a formula. You can use the dimensional analysis. But why should you learn one over the other? Why learn this difficult dimensional analysis and not just learn a formula? Because I will tell you this, formulas are actually easier to use. They're very simple and easy to memorize. The problem is that there are multiple styles of questions, of dosage calculation questions, where the formula will not work and you will get the wrong answer. While the dimensional analysis strategy will guide you step by step and tell you exactly the important information that you need to use in order to get to the right answer. For example, a formula that nurses use in this scenario very often is the doctor's order over on hand multiplied by volume. And yes, it is an excellent strategy. It is an excellent formula, but I want you to be disciplined and try to learn the dimensional analysis. That way, when there is a higher difficulty question, you can still answer it. Because I assure you this, bigger, longer question, more difficult questions, formulas does not work. Okay? So the first step is to identify or collect the information. So let's collect the information. The prescription comes dexamethasone 6 milligrams IV push stat. What this is telling you that you will be administering per doctor's order 6 milligrams IV per dose. So we're going to turn that into a fraction. We're going to put 6 milligrams per dose. So that is our first fraction. The second fraction that we will be using is what we have available. What we have available is 4 milligrams per milliliters. So that is our other fraction, 4 milligrams per milliliter. Then you have the question, which is another fraction. It says the nurse should draw X amount of milliliters into the syringe for the dose. In other words, the question is how many milliliters per dose? That is my question. So we have completed the first step of the dimensional analysis strategy. The second step is to identify or determine if you need a conversion factor. Remember, what is a conversion factor? You're trying to convert one unit into another unit. So how do we determine if I need a conversion factor or not in this scenario? Well, let's look at the units. We have milligrams and we have milligrams. 6 milligrams, 4 milligrams. We have dose and dose. And we have milliliters and milliliters. So as you can see, we have a partner for every unit. Milligram with milligram, dose with dose, and milliliters with milliliters. I do not need a conversion factor. You will see on other questions that we need a conversion factor. So once you determine and collect the information and determine if you need a conversion factor or not, then you will start to solve the problem. The next step is very important because if you begin incorrectly, you will make a lot of mistakes. So how do you begin your equation? How do you begin to solve the problem? You begin with the question. The question is how many milliliters you will administer per dose. So you will begin with the question with that milliliters per dose equal. So that is how you begin. The next step, it is extremely important. You know that in a fraction, you have something called a numerator and a denominator. The numerator is the one number on top of the fraction. The key to remember is that in your first fraction, you need to have the same unit that you have in the numerator in the question itself. As you can see, we have milliliters here. I need milliliters on the top in the first fraction. So I will find what information has milliliters. We used the question already. I'm going to circle it so I know that I don't have to use it again. Now I have 6 milligrams over dose. That's not the first fraction. And then we have 4 milligrams over milliliters. But we have to remember the rule. I need milliliters in the numerator. So what I will do, I have to flip the fraction. So this one, 4 milligrams over milliliters, I will flip it. And it would look like this. 1 milliliter over 4 milligrams. And you may ask, Professor, why do I have to do this flip? In this scenario, you have to respect the steps of the dimensional analysis strategy. All you have to do is learn it. Don't question it, learn it. So now we have milliliters in the numerator in both the question and the first fraction. You see, milliliters, milliliters. They are the same in the numerator. Now, what do I have to do? I have to put my other fraction, but I have to cancel milligrams. Why do I want to cancel milligram and not milliliters? Because you need milliliters for your answer. I need to cancel milligrams. How do I cancel milligram? On my next fraction, I need to have milligrams on the numerator. So, what is the next fraction? 6 milligrams over dose, over 1 dose. Now I can cancel milligrams and I will have available milliliters per dose. Now, hear me out. This is a very simple question, okay? Very simple question. I am teaching how to use the dimensional analysis. But you have to listen to this video multiple times. This is not something you learn overnight. It is difficult at the beginning, but once you learn it, it will make your life easier. So what do I do now? Now I will multiply 1 times 6 and 4 times 1. Where did I get this 1 times 6? Here, the numerator. 1 and 6. 1 times 6 over 4 times 1. And that is equal to 6 over 4. If I divide 6 divided by 4, the answer is 1.5. 1.5 what? The question, milliliters per dose. Now, it says record your answer using 1 decimal place. So what will be my final answer? What will I put on the NCLEX? I will put 1.5. A frequent mistake that I see here is that some nurses, they try to round and they come up with a new answer of 2 because they round 1.5 to the whole number and they get a 2 for the answer. But that is incorrect. The question states, record your answer using 1 decimal place. It doesn't say round your answer to the whole number. If you do all this calculation and at the end you round and you put the answer 2, it is incorrect. So do not round if they don't ask you to round. That is extremely important. Okay? So this is the first question. Very simple, not too difficult, not too many steps. Now, let's use the same strategy. Let's use the same strategy to answer a drop style question. To answer drops per minute style question. As you could see, I mentioned a strategy here for this question. For this question, you could use another formula, which is the drops per minute formula. But that is another formula that you have to learn. If you learn how to use the dimensional analysis, then you can use the strategy on both the previous question and this question right now. So what are we going to do? We're going to begin with the first step. What is the first step? Read the question and collect the information. What is the information that we will be collecting? We have to find those fractions. It says, a 4-month-old client has a D5 half normal saline intravenous prescribed to run at a rate of 40 milliliters per hour. So that is my first fraction. 40 milliliters over 1 hour. Let's keep reading. While the UAP, the unlicensed assistants, obtain an infusion pump, the nurse sets the drip rate at how many drops per minute? So here's the question. Drops per minute. That is the question that we have to solve. But they're giving you another information. They're telling you that the drop factor that you will be using is 60 drops per milliliters. Then it says, provide a numerical answer. Record your answer rounding to the nearest whole number. As you can see, in this question, they're asking you to round. So at the end, after we solve the problem, you have to round. But do that at the end, once you get your final answer. So we have collected the information. We've completed step number 1. Now we got to do step number 2, which is, do I need a conversion factor? Yes or no? Well, let's see. I have milliliters, 40 milliliters, and I have milliliters down here. Okay, same unit. I have drops, and I have drops, same unit. But then I have minutes, and I have hours, not the same unit. Remember, they need to be together. They need to be the same unit in order for this to work. So I need a conversion factor. I need to convert minutes to hour. What is that conversion factor? Well, there are 60 minutes in 1 hour. So that is my conversion factor that I will be using on my equation. How will I begin to solve the problem? Remember, with the question. And what is the question? How many drops per minute? So that is my question. How many drops per minute equals, now I have to follow the same step. My first fraction need to have drops in the numerator. What information that I have collected have drops in the numerator? 60 drops per ml. So that is what I'm going to have. 60 drops over ml. Perfect. We have used the question. So I'm going to circle it so I know that I used that already. I already used 60 drops per ml. So I'm going to circle this one. Now I need to cancel milliliters. How do I do that? My next fraction, I need to have milliliters on the numerator. So I will put 40 milliliters over 1 hour. Excellent. I can cancel milliliters now. Now I need to cancel hours. How do I do that? How do I cancel hours? I have to use the conversion factor and change hours to minutes. How do I do that? How do I plug it into the equation? I'm going to put 1 hour over 60 minutes. And you say, well, Professor, how do you get 1 hour over 60 minutes when we determined that the conversion factor was 60 minutes over 1 hour? It's the same thing. The only thing that I did was flip it. In 1 hour, you have 60 minutes. Or you can say there are 60 minutes over 1 hour. It's exactly the same thing. So now I can cancel hours, and I am left with drops and minutes. How do I know that I have reached the end of this equation? Because I have drops on the numerator and I have minutes in the denominator the same way I have it on my question. Okay? So mLs were canceled, hours were canceled, we're left with drops and minute. Now all I have to do is multiply the numerators, multiply the denominators, and divide in between them two. How do I do that? Like this. 60 times 40 times 1 over 1 times 60. We're going to multiply. The answer will be 2,400 over 60. Now I will divide 2,400 divided by 60 equals 40. 40 what? 40 drops per minute. Remember the beginning of the question. It states, record your answer rounding to the nearest whole number. In this case, we do not have any decimal place. So there's not really much that we gotta do. The final answer is 40. 40 drops per minute. Okay? All right. Remember, this question was a little bit more difficult. The next question that we will be doing will be more difficult. Okay? Hear me out, guys. In order for you to learn this, you have to have some patience. Okay? You really have to listen to this video multiple times. Okay? You don't learn this overnight. Math is very difficult, and it is more difficult for some people than others. Some nurses, they're very good with math, and they grasp this concept very quickly. When I first learned about the dimensional analysis and I looked at it, it was like, wow, this is a big mess. I didn't really like it at the beginning, but I was struggling so much with the different type of formulas. I was making a lot of mistakes. So I really made a promise to myself to really learn this dimensional analysis, because I was taught that it is the best way to solve NCLEX dosage calculation question. So please have some faith and really learn this concept. Let's go to the next question. The next question states, the healthcare provider orders lidocaine drip at 2 milligrams per minute for a client who has multiple premature ventricular contractions, or PVCs. The intravenous bag has 2 grams of lidocaine in 500 ml of normal saline. At which rate should the nurse set the intravenous pump? And it states, provide your answer in milliliters per hour. So let's begin with the first step. What is the first step? The first step, it is to collect information. Let's find the fractions that we will be using in the equation. Okay? The first one is lidocaine drip, 2 milligrams per minute. So I'm going to put 2 milligrams over minute. It says the intravenous bag has 2 grams of lidocaine in 500 ml. So I'm going to put 2 grams over 500 ml. At which rate should the nurse set the intravenous pump? Provide the answer in mLs per hour. So I'm going to put ml over hour. Perfect. I collected the information. Now I know what I need to do to solve this equation. The second step is to identify if I need a conversion factor. Look at the units. We have milligrams and we have grams. They're not in the same unit. I need a conversion factor. I need to convert grams into milligrams or milligrams into grams. So I will say 1 gram over 1,000 milligrams. That is my conversion factor. Now we have minutes and I have hours, not in the same unit of time. I need to convert minutes to hours or hours to minute. So I can say 60 minutes in 1 hour. As you can see, this information, I pulled it from memorization. It is not provided in the stem of the question, and they will not provide it on the NCLEX. So you have to memorize these conversion factors. Now I will begin with the question. And what is the question? ml per hour. So that's what I will do. ml per hour equals, and I will begin. So I use this piece of information. You already know that I need milliliters on the numerator. So my first fraction needs to have milliliters in the numerator, but none of the information I have has milliliters in the numerator, but I have one that says 2 grams over 500 mLs. What can I do? Flip it. So I'm going to put 500 ml over 2 grams. Perfect. I use this information. Now my next step is to cancel grams. How do I do that? I need to have grams on the numerator of the next fraction. What information has gram in the numerator? The conversion factor, 1 gram over 1,000 milligram. So that is my next fraction. 1 gram over 1,000 milligrams. Now I need to cancel milligrams. How do I do that? I need to have milligrams on my next fraction in the numerator. Do I have any fraction that have milligram in the numerator? Yes. 2 milligrams over minute. So I'm going to put 2 milligrams over 1 minute. Now I am able to cancel milligram. I need to cancel minute. How do I cancel minute? I put minute in the next fraction in the numerator. I'm going to use the other conversion factor, 60 minutes over 1 hour. Okay? So now we can cancel grams, we can cancel milligrams, we can cancel minutes, and what are we left with? Milliliters in the numerator and hour in the denominator. This is what's telling you that you are in the right track. What am I going to do next? I'm going to multiply 500 times 1 times 2 times 60. And I will multiply 2 times 1,000 times 1. If we do this multiplication, we have 60,000 in the numerator and 2,000 in the denominator. Now we will divide 60,000 divided by 2, and that equals 30 milliliters per hour. Okay? In this scenario, it doesn't ask you to round, it doesn't specify any other instruction. We provided 3 different examples of how to use this dimensional analysis strategy to answer dosage calculation style of questions. Review it again. This is like the 5th time I've mentioned this. Review it again. Have faith, and you will really, really learn how to solve dosage calculation. I want to say this because sometimes nursing students, they get too worried with dosage calculation. I truly believe that a dosage calculation question is not going to determine if you pass or fail the NCLEX. Many students, many nurses go to the NCLEX and they don't even see a dosage calculation question. Some students maybe find 1, maybe 2. And let's say you answer it wrong for whatever reason. You're weak in dosage calculation, you don't know how to do it very well, and you get it wrong. You get the 1 dosage calculation question wrong. That is not going to determine if you pass or fail the NCLEX. So, yes, learn it. Do the best you can to learn it, not only for the NCLEX, but for real life nursing scenarios, because you might use this someday. Trust me. I was an ER nurse and I used it pretty often in the ER. So learn it, but do not lose sleep over this. If you are here for the first time in our YouTube channel, go ahead and make sure you subscribe to our channel so you don't miss any of the other trainings. And also like this video at this moment. If you've liked the content that I have provided, like this video and share it with other nursing students out there.